What's the most overlooked bias built into digital health technology today?
Gender. Hands down. It's very easy to hide behind a computer and to say hateful things or do damaging things or post, hateful comments. I'm worried about kids. I'm worried about children. Like, child safety online is a huge concern.
Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Dr. Patricia Mechael, co-founder and CEO of Health Enabled, and a senior associate in the Center for Global Digital Health Innovation at the Johns Hopkins Bloomberg School of Public Health. Patricia Mechael has been instrumental in defining and advancing the field of digital health and mHealth within the global health space, leading efforts to design, evaluate, and scale national and subnational digital health strategies in more than 40 low and middle income countries. As co-founder and policy lead at Health Enabled, she has helped countries measure digital health maturity and adopt responsible technologies, including mobile health, wearables, remote patient monitoring, and AI to strengthen health systems and promote health equity. Mechael's expertise spans AI for health equity, global health policy, and personal connected health, and she's widely recognized as a pioneer in the use of mobile technologies for health. Her leadership roles, such as Executive Director of the mHealth Alliance at the United Nations Foundation, Executive Vice President of the Personal Connected Health Alliance, and member of the World Health Organization Guideline Development Groups for Digital Health and Self-Care, have positioned her as a thought leader, shaping how countries and organizations harness digital tools to improve access, quality, and outcomes worldwide. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry's inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we're bringing you face-to-face with the industry-leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty of building and scaling healthcare companies, the hurdles they've overcome, and the strategies that have led to their success. More importantly, we dive into the personal challenges that come with trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or just someone passionate about the future of healthcare, this podcast is your backstage pass to the minds shaping the industry. Now let's have Patricia tell us a little bit about themselves. Welcome, Patty, to the K in Clarity podcast. For the people listening, can you give a brief overview of who you are and what it is you do?
Sure. So I'm Patty Mechael. I am a global health specialist. I work on digital health initiatives around the world. And I'm the CEO of Health Enabled and a professor at Johns Hopkins University.
Wonderful. As you might know, we like to do an icebreaker here. And so my first icebreaker question for you is, if you could instantly reprogram, one feature of digital health or social technology, to benefit women and children worldwide, what would you choose and why?
So I would choose to create algorithms that favor the truth and kindness, because right now we have so much misinformation and disinformation that is particularly targeted towards women and adolescent girls, that is just causing a lot of damage to health outcomes, particularly in mental health, but also in physical and social health.
Your career, as we, discussed previously, has spanned global public health, digital innovation and policy as well. And so going from early mobile health in Africa to launching Health Enabled in DC, what originally drew you to combining technology and public health? And how has your view of the field's, opportunities really changed over time?
Now, that's a really great question. I mean, I started my career in global health, so I saw kind of like firsthand how, having access to technology or access to communication could help improve access to transportation in emergencies, as well as to healthcare providers for consultations and health information. And I was inspired by that to take a step back from global health and work for a .com in New York because I wanted to learn everything I could learn about implementing technology from a business perspective. And then I did a PhD looking at mobile phones and health, applying what I had learned through my work at the .com. And then that just kind of like led to this like incredible career and trajectory, exploring various aspects of how mobile technology could be used to support health workers, to, support each other and communicate with each other, as well as telemedicine services. So how people could, access healthcare providers through teleconsultation, as well as, using technology to do things like disease surveillance and provide supportive messages to pregnant women depending on the stage of their pregnancies or the age of their children. And that early experimentation period, which was sort of in the early days where mobile phones were really starting to take off, was really exciting and interesting. And I had the wonderful privilege of working on a project through Columbia University with Ericsson to apply new innovative thinking in 10 countries in Africa and kind of see what would stick. And there are a few things that are actually still in existence today, from projects that we were experimenting with in 2008, 2009. So more than 15 years ago, which is really exciting. And that led to my work with the mHealth Alliance and launching the mHealth Alliance and leading the mHealth Alliance. And then out of the mHealth Alliance came the inspiration for Health Enabled. So there was, in the early days, there were a lot of questions around like will mobile phones help improve health outcomes and access to health services and all of that, to how do we do this? How do we do this more effectively? How do we support countries, particularly those low and middle income countries that I was most interested in working in, particularly being from Egypt? And then how do we kind of like guide them through a process to look much more, strategically at how countries are investing in technology for the benefit of their citizens.
Tying to what you've done, you were really the first to research mobile phones for health. And so long before digital health became this type of buzzword, looking back to what you did early at mHealth, what do you guys really get right, and maybe what would you do differently if you had to start over?
Sure. So, in the early days of mobile health, there was a lot of investment in like ethnographic work. So, really to like try to understand the way people were accessing health services and health information, the way people communicated, what people's technology access looked like, even like workflows within health systems, and really taking kind of a good look at people's perceptions, their behaviors, their knowledge, and those sorts of areas to then inform the like participatory design of technology as well as content. And I feel like over time there sort of became this like arrogance of like, well, we know what people need, and we stopped investing in those deep dive ethnographic studies or deep inclusive design approaches, and making sure that all stakeholders that need to be involved in the use of a technology or digital health intervention were engaged in like the design of that intervention. And I feel like over time we've kind of like moved more towards like donor driven investments in in digital health that have not necessarily been what the country's priorities are and or what like individuals, would necessarily prioritize for themselves or how they would use or interact with technology. And so fast forward now, I would, really push to apply more of the kind of like femtech approaches to technology, which prioritize privacy and safety. They prioritize very in depth user centered design and principles of protection and do no harm while looking at how do you like improve health outcomes among people through the use of technology. In the early days of mobile health, there were a lot of women. There were a lot of female pioneers in the space. And then over time, a lot of that shifted. And then we just have a lot more like male technology developers and programmers from the global north, designing and implementing technology for use by women in low and middle income countries. And it's just not working. It's not, we've done some research and evaluations where we've seen that when you take a, gender intentional approach to digital health, you can really maximize your health outcomes. And when you don't, you just like hamper them. It's not that you don't still achieve something, but you're not actually like getting the most out of the technology investment as you could.
Tying to that, as digital health, has scaled in countries like South Africa, India, Nigeria, what are the biggest lessons you've learned about, building solutions like you just mentioned and partnerships that actually reach and are valued by those end users?
Well, most of the digital health interventions that have scaled have largely been, public-private partnership type initiatives where you have the government providing strategic guidance and leadership, as well as like the regulatory environment to de-risk investment by the private sector, and the private sector coming in and investing their own resources to innovate, test, do the like research and development, and then support deployment at scale. And so, I think of initiatives like Mom Connect, which, started as an investment between the US government plus Johnson and Johnson across, a number of different countries. And those early investments then got kind of taken up by government's vision. So you had, the head of the National Department of Health of South Africa saying, we want to register every pregnant woman in South Africa to receive these mobile messages because we know that it will like improve pregnancy outcomes and health outcomes for children. And then there was also investment in research to evaluate, whether or not that was true. And we found that, in, countries like India, in South Africa, that, through these mobile messages that there, were reductions in reductions in mother to child transmission of HIV, improvements in immunization completion, reductions in malnutrition in young children. And so it's really like exciting to see now like how some of these like early investments have then led to, improved outcomes as well as like scaled impact in these different settings.
One of your core messages is that, technology is not neutral. And so, in your opinion, why is this such a persistent misconception? And what are some of the most significant ways that, digital and mobile tech can actually reinforce inequity or bias in health systems from your view?
Sure. So, a lot of tech people will claim that technology is neutral. It's not the technology, it's how people use the technology. Um and which is true, and it's also the technology. So it's not just like how people use the technology. The technology itself has inbuilt biases, and the architectures are also, quite harmful and damaging. Like, when you ask me what I would like do over again, it's the underlying architecture of most social media platforms, and where they favor hatred because people will click more frequently on hateful statements. It favors misinformation and disinformation because people will click on that. And it's largely an economic model that is being capitalized on, that then is making money for, something entirely unrelated to whatever the content or the misinformation or disinformation is that's being perpetuated. And a lot of it is being designed to prey on, it's very predatory, to prey on women as mothers. And, no mother would want to see her child, be put at risk. And the way that a lot of the misinformation and disinformation is like perpetuated, it sort of creates almost this like guilt and fear-based communication that, is very much preys on the emotions of women and young girls, including around like body image, etc. We also see a significant rise in technology facilitated gender-based violence. So using technology to target women and girls in just really like unhealthy ways. And then there was a study that was done and published in Nature where, they showed that during the pandemic, that when Facebook hired fact checkers to kind of like pull down the misinformation and disinformation, that there was not a reduction in misinformation and disinformation, that actually there was an increase in misinformation and disinformation. And a lot of it is because the architecture was sort of like funneling um, content in such a way that it would perpetuate the misinformation and disinformation. And a lot of the content that's online, a lot of like health research content is biased. It's predominantly like male oriented, a certain like type of male orientation, including in health research, that a lot of clinical trials are done on predominantly white men, and then the therapies or the protocols are used across everybody. And so what this means is that you have things like heart disease, algorithms to do prevention and early treatment of heart disease that miss women and miss people of color because they are based on research and data on white men. And so what this is doing is it's creating this like increased inequity within technology ecosystems that, we now need to kind of find ways to overcome.
Tying to what you're talking about, I think a lot of your work tackles what you call the digital determinants of health. And so what risks concern you most as tech becomes more intimate and immersive?
I'm worried about kids. I'm worried about children. Like, child safety online is a huge concern. Like, I myself have a 13-year-old son. He has a flip phone. He's not very happy about his flip phone, but you read the studies that are coming out, and like the dangers that are, befalling our young people. One, they're losing their ability to pay attention, their attention spans. And then also, two, they're finding themselves in increasingly dangerous territory, whether it's, predators, child predators that are in gaming environments that are, chatting with young people, whether it is like sextortion happening where young girls are being asked to share like naked photos, or even children like deep faking each other without fully realizing the impact or the effect of what it is that they're doing like on each other. And so it's very easy to hide behind a computer and to say hateful things or do damaging things or post, hateful comments. But then the psychological and the mental effects of that on people and their well-being, particularly young people, where their frontal cortex is like still not fully formed and they're still learning discernment and growing, etc. And that's not to say that technology can be very beneficial for young people. We see both the positive effects and the negative effects of technology. For young people, research has shown that when technology is used to connect with people that you already interact with in the real world, it can have a very positive effect. So, connecting with friends, connecting with grandparents, connecting with, family members, very positive effects. What's happening though is that a lot of times young people are interacting with strangers or with content that's coming from places that where it's being recommended to them, but they don't really have control over it. And it's really kind of creating some dangers in that respect.
You've worked with, ministries of health, donors, and tech partners to design policies and programs. I'm curious to know what's the key to effective digital health governance, and how can countries really avoid the pitfalls of under and over regulation?
So, the number one thing is that countries really do need to make sure that, whatever it is that they're prioritizing from a technology perspective is aligned with what they're trying to achieve from a health perspective, right? Like a lot of times technology gets developed and implemented for the sake of technology, but it's not, intentionally developed and designed to address specific challenges or problems or to create, specific new opportunities. So having a very like clear vision and direction for what it is that you're trying to achieve using technology is number one. Having the right, governance, the right leadership, the right workforce, like maturity, having health workers that have been trained in the use of digital tools, is probably one of the biggest challenges that a lot of countries face. And so, they're not including, digital literacy in like medical school curricula or in nursing school curricula. And so you have health workers being deployed with medical knowledge, but not necessarily with how to like embed technology into their work and infrastructure as well. For countries that are trying to deploy digital technology at scale, if you don't have good connectivity and you don't have like mobile network penetration, you're not going to be able to reach the populations that you really want to reach. In one of the studies that I'm co-leading right now, the Digital Health Exemplar study that's funded by the Gates Foundation and being led by the Johns Hopkins School of Public Health and the Center for Digital Health and Implementation Science in Ethiopia, what we're seeing is that women's mobile phone ownership is one of the major determinants of advanced health outcomes in a lot of countries. And I think this has like two effects. One is that as a digital determinant of health, having access to mobile phones opens up new opportunities. It opens up access to education. It opens up, socioeconomic benefits. It also enables people to access digital health services. And so what we're finding is that the infrastructure and even just basic technology is sort of like a foundational piece to if you really want to harness like the full benefits of technology.
I think tying in leveraging technology, I think you've seen that, simply building just a new tool or a data stream doesn't always guarantee that it's actually used. And so what strategies have you actually found most effective for encouraging, true data usage by, frontline health workers and not just data collection for, collecting data's sake?
Yeah, one of my early learnings, and it was sort of like a big fail, was on a project that we were implementing to use like SMS messaging for health workers to like register pregnant women and kind of like track pregnancy outcomes and then register kids and then track, children's outcomes. And this was like in like the like late, 2000s. So it was like 2008, 2009. And a couple of years later, we did an evaluation of this implementation, right? And in one of the sites where we were implementing this program, we found that we had like a whole cohort of pregnant men. And it was one of those things where we're like this looks weird. And it was like an anomaly in like the data model. There were not actual, pregnant men in Senegal. But what it showed us was that like nobody was looking at the data. Nobody was like paying attention to like what was happening. They were implementing the program, but they were not necessarily using the information from the implementation of the intervention. And so over time, what we've done, and I think we're doing it like better and better, is to engage people in developing like dashboards that can unlock the data that they do have, right? And making the data like more accessible and useful from a like programmatic perspective. So like for example, in immunization programs now, there's a lot of work that's being done to register children and then track to make sure that they are on time for all of their vaccinations, and then alerts and, reminders are sent to families to bring the kids in for the immunization. But then for the health system, they get, on their dashboard, they get a list of children who are overdue for their, vaccination so that they can then better target their follow up. So I think we've gotten a lot better at making data more like useful, accessible. It's not perfect. We see a lot of like variation at subnational levels, depending on how high the digital literacy is, depending on like workforce capacity, depending on systems to bring people together to talk about the data. You either see huge uptake in the use of data or like really low, uptake in the use of data.
I think I also want to speak about, maybe a lesson that you've learned, which is, what's the aha moment that you had around participatory design and what makes product co-creation with users, whether it's women, men, youth, or clinicians, actually work in digital health?
So, my aha moment was really around the gender intentional approach to digital health that I think we hypothesized that this would be true, but it wasn't until we started doing gender sensitive research that we really saw that when you took a gender intentional approach, you could really maximize your impacts and your health outcomes. And when you didn't, you would still achieve something, but you wouldn't necessarily like maximize the impact. And so to me, really being thoughtful and taking this like intentional approach is really, really critical. Intentional for whatever it is that you're trying to do, right? If your program is like designed to improve like maternal and child health, like gender and gender dynamics are going to make a difference. If your program is designed to improve youth, making sure that the health of youth and the health of young people, like making sure that young people are very actively engaged in like the design and the implementation and the uptake of interventions, reproductive health and sexual health education in a game is a much better approach than just lecturing young people or sending them like medically informative information. And so a lot of times like we will design things based on our own preconceived notions of like what is needed and how it should be done. And it's not really until we go and we spend time really like living in and working alongside like people in their day-to-day lives that we can then come out with technology that really fits in the way that people live.
Tying back to, what you said earlier, as technology becomes more capable of both helping and harming, What's needed for more proactive, digital literacy, especially among the youth in maybe lower and middle income countries?
Yeah, I mean, I think we definitely need, a lot more education among young people kind of like the do's and don'ts of digital technology, and awareness raising on some of the research that has been done and that is out there, but in like child friendly and youth friendly ways. And I think, the country that has done this like the best is probably Finland, which has, a long history of trying to address like misinformation and disinformation, particularly from Russia's manipulation of their technology ecosystem. And so they've taken a very proactive approach to cybersecurity to combat some of the breaches that they and the cyber attacks that they have. They've also, spent a lot of time developing curricula for young people to like encourage young people, even from very young ages, to be like responsible digital citizens. And I think we need to really think about digital citizenship because there is an online world and then there's a real world. And the two are getting very blurred these days. A lot of things that are happening in the online world are spilling over into the real world, and things in the real world spilling over into the online world. And so we need to kind of just increase everyone's awareness of the dangers that they're being exposed to in this like increasingly like digital world. And countries need to regulate, and we're not seeing a lot of very strong regulation coming from like the United States, where many of the most harmful digital platforms, particularly the social media ones, are coming from. I think Europe is doing a much better job of regulating technology. And then in a lot of low and middle income countries, the regulation is like nowhere near what it would need to do to like protect from the harms that are coming out of technology.
How's your experience as a female leader and a policy advisor in both global health and technology shaped your perspective on mentorship, career growth, and what the field actually needs for its next generation?
So, when I first started my work in mobile health, a lot of the early pioneers were women. But it was still like a very nascent field. And then we would get invited to these like big tech, conferences and environments. And, it would be like mostly men and like a handful of women in these like tech environments. And I count myself as very fortunate because I went to um, an all girls secondary school that really helped me kind of like find my like voice and my leadership MO in a safe space. And I think that's like what we need. I think we need to cultivate like safe spaces for like young women, young professional women to kind of grow through the career ladder. We're seeing a lot of, women leaving the workforce because there are not like family friendly like policies and strategies. We're also seeing a lot more fear-based and leadership and like toxic masculinity and harassment in the workplace that makes it, very difficult for like young women who want to, be actively engaged in these like professional spaces, but it's just not like supportive or conducive to their participation. I feel lucky that I grew up at a time where there was the ability to advance as a leader, as a woman. I think it's becoming harder now than it had been before. And I think we need more women to kind of come together and support each other to kind of then create the path for younger generations. And we also need, workplaces that are much more compassionate and protective of people's, social, mental, and physical health and well-being. There's a lot of attrition happening in workplaces, and a lot of it is because of this like toxic and unsafe environment.
Looking ahead, what innovations or policy changes do you believe could, have the biggest positive impact on health equity, digital safety, or resilience in the next decade, especially with AI on the loom?
So, what we've learned through the research is that representation matters. So, making sure that whether it's policies or technology or anything, that like people are represented as part of those processes, whether it is women, people of diverse cultures and backgrounds and races, ages, people living with various disabilities, etc. We need this level of inclusion. And it's not a tick box. I think there's a lot of backlash around DEI and this like tick box approach to representation. I think, but we do need to have just a lot more perspectives shaping the technologies that are impacting our lives, and representation in the data, representation in the algorithms development, the models, as well as like representation in policymaking. Policy does not, like, supportive policies don't happen unless the people that are like most impacted by them are engaged in the process. And so we just did a study in Ethiopia where we looked at gender and in digital health, and what we found was that the majority of caregivers and frontline health workers were women. The majority of supervisors and administrators are men. The majority of policymakers are men. So in the immunization policy, it was like 25 people, 25 men developing the immunization policy. Who delivers immunization services and who goes to access the immunization services? Mostly women. Technology development, 99% male. Who is using the digital health technologies and applications? Predominantly female frontline health workers. So there is this like mismatch that is happening. And it's not just like a nice to have. It's like the ethical thing to do.
My last question for you before we go on to the lightning round is that you've co-created tools like the Global Digital Health Index and worked on national digital strategies. And so what's the North Star or guiding principle that keeps you optimistic about, digital health's future and rapid change that's abound?
So, I recently met with the Minister of Health of Rwanda, and Rwanda now has this incredible like emergency operations center for health where they're pulling data from like all these different sources of data, and they're looking at it, in a much more kind of systematic way with the intention of really improving maternal and child health. And what they found was that like the majority of maternal deaths happen in the middle of the night on the weekends. And so they've now like shifted the coverage schedule for midwives and nurses to cover those times that like, had not been like covered before. So what we're seeing more and more now is just like a lot of really incredible innovation coming from, the countries themselves, and people that really care about the health and well-being of their people and of their citizens. And, one of the reasons that I like love working in global health is that, in most countries in the world, health is a basic human right. And people do genuinely believe that like everybody has the right to live a full and healthy life. And they will take whatever little resources they have and try to like apply them in ways to improve people's health and well-being. And to me, that's what keeps me optimistic, is that like you have, inspiring figures like Dr. Sabine in Rwanda or Dr. Muhammad Ali Pate in Nigeria, where they're also doing like really great innovations of like, most women want a female obstetrician gynecologist. They want to be cared for by another woman for their maternal and child health. And they couldn't get women to travel to these remote settings to go and provide, maternal and child health services. And so what they're doing is they're providing these like innovative approaches using technology to encourage women to spend periods of time working in some of these remote settings, but also building schools in those areas so their kids have somewhere to go. They're paying higher salaries to incentivize the women to go so that the families will benefit from the mother being gone for periods of time so that she can provide these services. And so I think there's like a lot of ways that countries are like now much more switched on to the power that technology can have, and you're finding ways to apply it to benefit their people.
Well, it's time for the lightning round. And so, my first question for you is, what's the most overlooked bias built into digital health technology today?
Gender,
Mm.
gender, 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 hands down.
In one sentence, what's the biggest myth about scaling digital health in low and middle income countries?
That if you build it, they will come does not happen that way. If they see value in it, they will come. And if they were involved in it, they will appreciate it.
What country or project gives you the most hope that digital health and equity can move forward together?
Brazil. Brazil was one of our digital health exemplar countries. They have one of the largest primary health care electronic medical record system in the world. And it is an equity-based digital health approach. And it is truly inspiring that they have been able to do this at the scale that they have been able to do this.
Well, Patty, thank you for your time today. Before we wrap up, is there any final thoughts that you have for the audience?
Thank you for having me. This has been such a fun conversation. I love that you're doing this.
Thank you.
And yeah, you asked really great questions, and thank you.
Thank you. Thank you. Where can people choose to connect with you if they choose to do so as well?
Sure. So you can find a way to connect with me on my website at patriciamechael.com. And please do reach out to me and or on LinkedIn.
Well, Patty, thank you for your time today on the K in Clarity podcast.
Thank you.